Welcome to Talking Allergies, the podcast where we talk all things allergies about all types of allergies in all kinds of allergy lives.
From food allergies to environmental allergies, special guests, community stories, allergy and science giveaways, and more.
This is your allergy podcast for all things allergies. Hi, Melrick.
Hi, Grace, and welcome to another episode of Talking Allergies.
Today we're talking allergies and the skin.
That's right. Allergens can affect the skin in many different ways, and they occur when the skin becomes irritated because the immune system reacts to something that is usually harmless to others, but for a person with allergies, it can cause rashes, itching, burning, redness, bumps, hives, swelling. And these reactions can lead to common skin conditions such as atopic dermatitis or eczema, allergic contact dermatitis, 𝘥𝘪𝘵𝑒𝑎, or angioedema. And the symptoms can vary based on the type of reaction. Have you experienced skin-related allergic reactions, Grace?
Yeah, I've actually experienced all of those ones that you mentioned prior with skin conditions in different points of my life and in different skin reactions. How about you, Melrick?
Not all of them, but I have experienced atopic dermatitis or eczema and also allergic contact dermatitis myself. And, we talk about all types of allergies, but when we look at skin-related allergies, it can bring many challenges because from day to day, when you consider what you can come in contact with, who you can come in contact with, also the products you buy, where you go, and it can vary whether you're an adult living with skin-related allergies or you're a parent that has a child with skin-related allergies.
Allergies in the skin are just not spoken about enough, so it's really good that we're having this discussion today.
Yeah, and look, they are one of the more visible sort of allergies in that sense, so the reactions might be quite visible. I've had experiences myself where I've had a reaction where I've been about to go into something. So Mike has about to go into a meeting, about to go meet some people, and it's been a visible reaction, and you sometimes are very short on time of trying to manage it and sort of find a treatment for it, and you might not have the treatment on you, might not know what it's caused from. So it can lead you in a situation of trying to work out what's going on, and you just don't have answers sometimes. But it's one of those things where we just have to talk about it more so we can share the answers and, I guess, find solutions together.
It's one of those ones, especially with people thinking that it could be contagious. An allergic reaction is not contagious to anyone else, even though it may look really serious, and it is really serious. It's not contagious to another person.
And today we'll focus a little bit on allergic contact dermatitis, or ACD, which is a type of eczema. So contact dermatitis is a skin condition that shows an itchy and sometimes a weepy rash that usually appears after direct skin contact with an allergic trigger or irritant. It can come from contact with perfumes, plants, nickel, chemicals, cosmetics, and the like. Now, Grace, prior to this episode, you mentioned that you were going to share a story about your nickel related allergy with the skin. So you have allergic contact dermatitis to nickel, is that right?
I do, yeah. So I found out that I had a nickel allergy. I wasn't tested for it initially. I found out when I was going to buy some jewellery when I was a teenager, and I had contact dermatitis, and within 2 hours of putting it on, and realised that it was an allergy from that point.
Wow, so that does mean that you've got to be very careful with the gifts you receive and also the purchases you make. But not just that, nickel can be found in a lot of products that are not jewellery, can be found in everyday household products as well.
It can be. It can even be in stainless steel pans, depending on your allergy and your reaction. It's really important to get diagnosed by a qualified healthcare provider to see what you are allergic to and what you can handle and what you can't.
Yeah, and contact dermatitis affects 1 in 5 of the population, and the management does involve a lot of education and, of course, strict avoidance, which has its challenges, but being aware of what you're allergic to, what the substances are, what those triggers are, it can help you avoid them at the best you can. And with contact dermatitis, one of the ways to diagnose and understand what those triggers are and then what might be causing that reaction is through patch testing.
Patch testing and prompt diagnosis by a qualified healthcare provider is really important with skin allergies. So a dermatologist can help, but if you're really unsure, go to a GP and ask about the pathway options, so like referrals, to get you started.
Yeah, definitely speak to your GP. And even if you're unsure and you find a dermatologist online, reach out to them and ask them sort of about what your pathways are, whether they offer this sort of testing and what they do to support different kinds of skin-related allergies. People that are sort of listening in and they probably haven't heard about patch testing, or they might have heard about it in the past, but just to remind people of how patch testing works, how does it work?
So during patch testing, different patches are placed on the skin. So they're usually placed on the back and they're left for a couple of days, and then they're removed by the dermatologist, and they will actually look at what irritants you have, and then they'll give you a diagnosis on whether you actually do have the different types of contact dermatitis, what the triggers are, and your diagnosis as well, and then how they can help you.
And patch testing can certainly help. And if you have any questions about it, speak to your dermatologist, or as we said earlier, just reach out to your GP if you're not sure about it, just to find those pathways to get you tested and diagnosed, and of course find the treatments to manage your skin-related allergies.
So Melrick, you actually caught up with a special guest as well for this episode of Talking Skin and Allergies.
Yes, Grace, I caught up with Dermatologist Dr Francis Lai, who was fantastic to speak to. He was so informative and so supportive of people that have skin-related allergies. And I spoke to Francis about allergies in the skin, ACD, atopic contact dermatitis, how people can find support, and about the creation of CosMe, an app that brings educational information and guidance to the fingertips of those who are at risk or suffering from ACD. The app allows people to avoid high-risk ingredients to manage their ACD. It also allows clinicians to improve diagnosis and management of ACD.
That sounds great, really informative. Let's tune in.
Thank you, Francis, for joining us on Talking Allergies. To begin with, tell us a little bit about who you are and about your background as well.
Yeah, no, thank you for having me. My name's Francis. I'm a dermatologist from Melbourne. I work in public practice in Monash Health and also at the Skin Health Institute, which is a tertiary organisation for dermatological care. I also work privately for Virtual Dermatology, which provides services for patients across Australia to access dermatologists within 2 weeks. And I also work privately at Brighton and Williamstown Dermatology. I've trained through most of the tertiary hospitals in Melbourne and also was fortunate enough to do a fellowship at St John's in London. My special areas of interest include contact dermatitis, biologics, and clinical trials.
Thank you for that introduction. Now, Francis, you've worked across a range of in skin and allergies. How have you seen the impact of allergies on the skin with what you've worked across?
Yeah, the impacts are huge and really immense and can come in many forms. I think, firstly, allergies can affect skin from what we term as type 1 hypersensitivity, and this is immediate reactions, meaning you eat a peanut or you eat mango and straight away your eczema flares up within hours, and this mainly happens in babies and kids with eczema. The other type of situation where you can get allergies impacting on skin is what we term as type 4 delayed hypersensitivity. And this is where we have a condition called allergic contact dermatitis, where you may use a lip balm or a moisturizer or a sunscreen, hair dye, and it may even feel quite nice to begin with, but then you develop a delayed allergic reaction where 2 to 5 days later, your eczema feels like it's on fire and it's really burning and really having a huge impact. And I think we see that, in babies and kids, it has a big impact on not only the child, but also on their sleep, on their growth, on parents. And then in adults with delayed hypersensitivity, it has a huge impact because often there's a very long delay in terms of diagnosis. Often it's just put down to as, you've got eczema and you've just got to manage it without anyone sort of realizing that there's an allergic component to it. And they go for years suffering and not getting the right diagnosis. And with allergic contact dermatitis in adults, it's often affecting very visible parts of our body, like the face or the hands, places that we contact a lot. And it has a huge issue in terms of their quality of life and work and other aspects of life.
With all those different groups of people you've spoken about, so when should someone see a dermatologist?
Yeah, really good question. I think someone with allergies should really see a dermatologist ASAP. And as we know, there is a difficulty in accessing dermatology care sometimes in terms of the wait times. But really, the earlier you get in, the better we can diagnose and investigate and hopefully provide a treatment plan. Just to give an example, in babies and kids with allergic reactions, we can always refer them to the right services. We can consideration of skin prick testing with allergists, or we could do preliminary blood tests looking at immediate hypersensitivity. Whilst in adults with allergic contact dermatitis, that delayed hypersensitivity, the earlier they get in, the better, because we know that people who are allergic to one thing have a much higher risk of becoming sensitized to more things. And once you are allergic to something, you are forever allergic. So the sooner we can get on top of it, the better. And then we can give you sort of ways of avoiding and hopefully finding products that are suited for you.
Of course. And you talked about the wait times just before. Are there some ways that people can look at trying to sort of get around those wait times or have faster approaches to receiving that care? Could they go to their general practitioner or go directly to the dermatologist themselves?
Yeah, absolutely. I think, that's one of the two initiatives I guess I'm involved in that's trying to improve access. One is virtual dermatology, where we're providing teledermatology to patients across Australia with a wait time of less than 2 weeks. So we're hoping to try to break that difficulty in terms of getting in to see a dermatologist. And I guess something that we'll discuss a little bit later on, the CosMe app is a very accessible app that's available on the App Store. Yep. It's free currently, and hopefully it can allow patients to figure out what their potential allergens are and to empower them to find the right products and to avoid the potential allergens.
Great. Now, you work across a few different organisations, one of them being the Skin Health Institute. What sort of services do they provide people with allergies?
The Skin Health Institute is really one of the leading centres for both research, teaching, education and clinical trials, as well as providing excellent clinical care. And they have a tertiary contact dermatitis as well as occupational dermatitis clinic, where they essentially try to find out what are the potential allergens that are causing people to get rashes from things that they're coming into contact with or in their occupation and their line of work. They undertake patch testing, and they are Australia's leading organisation in patch testing, where they actually send out the patch test kits to the dermatologists across Australia who do patch testing in their private practice as well.
Now, Francis, you have developed an app in collaboration with the Skin Health Institute that helps people with skin-related allergies and navigating sort of the products to look for and so forth. What is the app called, and tell us a little bit about it and who it's for?
The app is called the CosMe App, and it's an app really designed for patients who do have or suspected to have allergic contact dermatitis. As you I'm sure are aware, every time you read an ingredient label on any product, it's a whole bunch of chemical mumbo-jumbo names, and it's really hard for the general person to know what is potentially an allergen. And the app really just provides a good traffic light system to show you what are the potential allergens and which ones to avoid. It also provides personalised recommendations based on your known or suspected allergens, and you can easily filter for products based on sort of categories and ingredients that you want to find. It's also a tool for clinicians and also a tool for the general consumer, because as I mentioned before, we know that yes, treatment is really important, but prevention is equally, if not more important, because if we can prevent people from developing contact allergies and they can just start off by using products that don't have many allergens, that would be ideal, because once you are allergic and sensitized, unfortunately, generally it's a chronic long-term allergy that you just have to avoid.
What got you to sort of work on creating this app for people with skin-related allergies?
Yeah, look, I think this is really just from my day-to-day work. I think as a dermatologist, I see every day the struggles that patients have in terms of finding the right investigation and treatment. These are 1 in 5 people do get contact dermatitis, and unfortunately it's super common. You react to your hair dye, to your sunscreen, to your makeup, to hand sanitizers, and people really struggle with this and really struggle to find a solution, and they often going for years, going through various healthcare practitioners, trying many, many different creams, or spending thousands of dollars trying to solve their own problem. And I guess that's really what's inspired me to realize that it's so difficult to get to the right diagnosis and the right management. And hopefully the app allows patients to feel empowered to find the right product and to thereby hopefully solve or prevent their allergic contact dermatitis.
So if you had to explain an easy workflow for someone who wanted to use the app for their contact dermatitis, how would you go into the app and use it?
Yeah, so when you sign up to the app, it will ask you whether you've had patch testing or not. And if you have, you can plug in the known allergens that you are allergic to. If you haven't, that's okay as well. And then when you search for products, it will come up with sort of labels saying this product is safe for you based on your known or suspected allergen profile. And you can also explore the app just based on products that you have on your shelf as well. So if you've got, various makeup products and sunscreens and moisturizers, you can plug in those products and see how many red, highly allergenic allergens it has, or yellow, moderately allergenic products, ingredients. And then you can also filter. So if you want to find a safe product for your baby, a moisturizer, you can choose a category and then filter to avoid certain allergens. So that is also possible too.
Wonderful. And how can the clinicians out there as well across Australia use it for their patients?
Yeah, absolutely. So I think this is really the aim as well, in that we want to help clinicians streamline their care for patients. So for dermatologists, we often spend an hour after patch testing trying to figure out what products a patient can and can't use, and it is very time consuming. And if we can improve our efficiency and clinic throughput, and we can thereby reduce the wait list and improve access. I've also spoken to many general practitioners and pharmacists who've been very excited to hear about the app, because as a pharmacist, they often get people come into the pharmacy and say, look, I've reacted to this cream, what other cream can I use? And often it is really difficult, even for healthcare practitioners, to know what products they can and can't recommend. So hopefully it's a tool not only for the dermatologist, but for allergists, immunologists, general practitioners, pharmacists, all to be able to use and recommend the right products to our patients.
Fantastic. And where can people find out about the CosMe app to download it and learn more?
So you can download it on all the app stores from Apple and also the Google Play Store. It's free for use at the moment, and it's also available on Allergy Life as well. And any feedback is obviously welcome. It's a brand new app, and it's made by volunteers with myself and Skin Health Institute. So we're very happy to take on board any feedback. You can also request new product recommendations within the app if it doesn't have the products that you currently have.
Thank you so much, Francis, for sharing all that information about dermatology, contact dermatitis, and the CosMe app as well. If someone is joining in and listening in and they have just discovered they've got skin-related allergies, a way to get started on that journey of diagnosis and treatment?
Yeah, look, I think apart from downloading the app and trying to see what allergens are within your products, one of the other, more practical ways is also what's known as repeated open application testing. So if you are suspecting you're allergic to a particular product that you have, you can apply that to somewhere that's quite sensitive, like the inner upper arm, every day for 5 to 7 days. And if you do develop an itchy allergic reaction, then that can be a telltale sign that you do have allergic contact dermatitis. And then obviously getting in to see a dermatologist and consideration of patch testing as soon as possible is best.
Wonderful. Thank you so much for all that information, Francis. We've really appreciated having you on Talking Allergies. Before we finish off, is there anything else you'd like to say or share with the allergy community in Australia?
No, just thank you so much for having me on here, and I hope that's been of use. And I think really just more awareness needs to be brought about for allergic contact dermatitis. It's often under-recognised and under-diagnosed. And as I mentioned, I have patients who struggle for years being told they just have endogenous eczema when they in fact do have an allergic component as well.
Great. Well, thank you very much, Francis. Appreciate having you on.
Thank you, 𝘠𝘪𝘵.
𝘠𝘪𝘵, that was a great interview with you and Francis. I'm really happy that I actually heard all that you spoke about and actually learned quite a bit.
Yeah, it was fantastic to speak to Francis, and thank you to Francis for his time to talk about how patients can navigate with their skin-related allergies, but also sharing about the CosMe app, which, as he said, is available to be downloaded from the Apple and the Google Play stores.
And to learn more about Francis, CosMe, and all the other episodes, go to allergylife.com.au/Talking Allergies.
And that brings us to the end of another Talking Allergies episode. It's been wonderful talking about skin and allergies, and we're certainly going to talk about this in more detail in future episodes. It does bring us to the end of another episode, but we are excited for the next episode, which is all going to be about selecting products when you have allergies.
Yeah, selecting products when you have allergies is really important because you're looking at all different types of allergies as well. And if you have intolerances or anything else that you're looking at as well, selecting those products is really important.
Yeah, and I believe, Grace, you met a very special guest as someone who has created an event, a show, an exhibition for people to find products to support them with their allergies.
I did. It's actually a really interesting interview too because she's also an allergy mum.
Wow, well, I can't wait to hear all about it in the next episode. But thank you for joining us for another episode of Talking Allergies. The discussions on Talking Allergies are here to support you or your loved one on your journey with allergies. The topics discussed here are not intended as medical instruction or as a substitute for advice by a qualified healthcare provider.